Hi, I'm Gilly Bond, a specialist pelvic health physio, and I'm answering your questions about bladder pain syndrome. So this question came in quite a few ways and from different people, but it basically comes down to, will I ever get better? Which is a question that I'm asked often in clinic is, will I ever get better? Has anyone ever been cured? And the answer is, what do you mean by cured? Will it get better? Yes. Cured is an interesting concept. If you are to think about cured in terms of will my bladder return back to normal function, where I can empty my bladder comfortably, I don't have to rush and it doesn't hurt? Yes. And that is what we're aiming for in physiotherapy. And certainly that's what your doctors and your medical teams will be aiming for, normal bladder function. And if that's what you mean by cure, then yeah, I can't give you a time scale on that. Because life happens and nobody is a case study, nobody's the same, we're all very different and our systems respond in different ways. But we do know that quality of life change is very achievable. We do know that normal bladder function without pain is a very, very achievable thing. In my research, when I did my research, probably 5 years ago when I started actually treating the patients for the trial, we have a duty of care to carry on treating people if we know that things are working beyond the trial. So there were about 3 patients that I continued to see after I'd finished the trial that hadn't been, not cured, but had got better to the point where actually they had no symptoms, okay? And that's the whole trial. There were only 3 people that I kept seeing. And of those 3 people, they all got better. And got to a point where they were managing their symptoms fine. Since then, I've had 1 or 2 people back in to see me, but they're all doing fine. And I don't hear from them very often because they've got all the tools to manage themselves. What you've got to think of is that if you'd had a really, really bad car accident and you've got a stiff neck and whiplash, and you had lots of treatment for that whiplash. Now we know these injuries are exactly the same in the way that the brain will become a lot more concerned about an area as being threatened or under attack. And tension will occur and hypersensitivity will occur. So any movement of the neck can be really, really painful. You end up moving like a block. You have treatment, you feel better, you get yourself moving, because movement is by far the best thing to do with everything, with all these movements, getting back to function. And it may be that when you sit in a car for 7 hours, or you sit at the cinema and watch all of Lord of the Rings, 1, 2 and 3, and The Hobbit, maybe not The Hobbit, you'd have to be there all day, a long period of time, you get a bit of a stiff neck. And thereafter it's a little bit sensitive for a couple of months or a year. But then that calms down. The more that you reiterate to your body, oh, I'm a bit stiff, oh, it's just a stiffness, I'm not worried about this, I'm going to stretch. And you stretch everything out and you move and maybe you go for a swim or you do whatever makes you feel good, then it goes away and it feels fine. But there is a potential there for it to be a little bit hypersensitive. Doesn't mean there's anything structurally wrong. There's nothing wrong with your tissues. You're just a bit more on edge, just in case I've hurt my neck again. So when you've had bladder pain syndrome, absolutely you can improve and get better and get to a resolution of your symptoms. And I think symptom resolution is what we're all aiming for. Now, I've done this for a long time now, and I've worked with hundreds and hundreds, if not thousands of patients, 16 patients a day, every day, for years. And when I say that people aren't coming back to me, I know that some people probably don't want to come back and have more treatment, but there's a lot of people that have walked out the door and I've never seen again and are absolutely fine managing. They get to the point, I only let them, we only discharge people when they are managing their symptoms well and there is a resolution in their symptoms. They're feeling loads better. That's what we're aiming for, and I've seen it happen loads, so it can happen. But what you have to do is put in time and effort to working bottom up, working with your pelvic floor and your bladder, and working top down, working with the software, with the brain structures that are altered and that make you feel like you're more under threat. And the more you do that, and it will take as long as it takes, and keep trying to move, keep trying to keep yourself as healthy as possible, resolution can occur. And I just want to reassure you that I have seen it happen loads and loads and loads. it takes as long as it takes. And sometimes, more often than not, you're left with a little bit of a hypersensitivity, so the potential for it to spiral off again. But as long as you've got tools to manage that yourself, whenever you have sex and then suddenly you're feeling a bit more urgent, you do your things that you need to do, you use your lubricant, you stretch, you do the breathing techniques, you go for a run, whatever it is that you need to do that you've worked on with your physio to get better. You do those things and that urgency for a day goes away. And then you're back to living normally. That's what we're aiming for. So yes, resolution can occur. Hi, while I've got you here for a second, if you're a physio or a physical therapist interested in learning more about what I'm talking about, how we holistically manage someone in pelvic pain with a much better idea of how to apply the best of pain science in the clinic, then my Happy Bladder course, which is based on bladder pain, but is really much more of a holistic view of how we treat all pain states in the pelvis. I'm working really hard to get that up online for everyone, hopefully early 2020, so the beginning of next year. So check back on the website, keep your eyes peeled on my social media, and if you're interested, the course should be going live early next year. Thanks.